All right, welcome back to Pharmacist on Call, your 1 hour forum. Your doctors are busy, your pharmacists are busy, they don't have time. For this hour, I do. So call in with those questions and those comments. Just also wanted to send another congratulations shout out to my auntie Reen, my mom's youngest sister. Wanted to send out a congratulations on her wedding to Mr. Willie Moss. So congratulations to you. She goes by Benita Daly, to those of you who are not related to the family. So congratulations, Auntie Reen and Uncle Willie, on your nuptials there. We're going to get right back into your calls. We've got Thelma on line 2. Welcome to Pharmacist on Call. How may we help you?
Hello.
Hello. How you doing?
Dr. Pruitt?
Yes, ma'am.
Well, you know this is Mom. How are you?
Pretty good. How are you doing?
I'm all right. And first, let me make a comment. I heard what you said about my granddaughter, Miss Jamesia.
Yes,
I
ma'am.
just want to let you know that since Miss Jamesia was fortunate enough to be born with all of the DNA of Jeremy and me and Mom and my grandmother and yours, of course, you will have an eventful life with Miss Jamesia. So count yourself blessed and lucky. Now,
yes, ma'am.
And don't you say anything bad about her. Now, my question is, what can you tell me about selenium?
Selenium?
Yes.
Oh, okay.
I mean, is selenium something that that is helpful to regulate sugar levels?
Sugar levels, and in men, testosterone. It's a trace mineral.
My goodness. So it's not for sugar at all.
Well, for men, yeah, it helps us synthesize testosterone, that and zinc.
Not for women.
Well,
not recommended for women as far as regulating sugar.
Well, it may be. I'm not sure about the sugar piece. I know it is used as a trace mineral to help with testosterone synthesis, but it may have a role in glucose control.
I see. All right, then. Well, you're going to talk about the water.
I'm sure that we will get a question about it. Even if we don't, I will bring it up.
All right, then. Well, thank you, Dr. Pruitt.
Yes, ma'am.
Have
You're
a
welcome.
great evening.
Yes, ma'am. You too.
I'm going to enjoy the rest of the show.
All right.
Bye-bye.
All right. Bye-bye. All right. James, line 1. Welcome to Pharmacist on Call. How may we help you?
Yes, I recently had my leg amputated like February 28th.
Okay.
And they give me some medicine the other day recently, and I took it, and I run short on like 4 days, so I had to go to the emergency room. And they give me 2 shots of Elida and told me to see my primary caregiver.
Okay.
And also make an appointment with my vascular surgeon. So I went to my primary caregiver, and they give me a 15 lower tab 5s. So I filled in, and then I went to my vascular surgeon, and he gave me 30 Percocets. And then I went to fill in, and the doctor said I was doctor shopping and tore my prescription up.
Okay. Well, so what happens is, who did you get the 15 lower tab from?
My primary caregiver.
Okay. Did you explain to the doctor who wrote the Percocet that you'd already gotten a prescription from the primary care physician?
No, I was going to, and he got to talking and everything, and then he got out before I got a chance to tell him.
Okay. Okay. Yeah, this is very common. So, and you asked a very good question, because it's something I've always wanted to touch on, but I keep forgetting. People, there is a monitoring database out there that we are able to see every narcotic that you're getting, and within a day's time, it all goes to this database. So, and not saying that you were doctor shopping, but just to educate you, make sure that you always let the other doctor know when another physician has written narcotics for you. Now, the other thing is, when you get those 15 lower tab, make sure that you stick within the time frame and stick to the directions that the doctor wrote, so that if he wrote you 5 days worth on Tuesday and you come back in Wednesday wanting more Percocet, it's going to raise a red flag with your pharmacist and also your physician, because he is also going to check the same monitoring database that I check every time, and every pharmacy is or should be before they fill narcotics prescriptions. So that's why probably what happened with the doc, but just explain to him, hey, you know, this was the deal. My primary care physician filled these for me, coming to you as the specialist, and that he's the only one after that is going to be writing anything for you. You follow me?
Yes, sir.
Okay, so are you referred to a pain clinic?
No, I asked him about it, and he said he didn't trust in pain clinics too much.
What was the medication they gave, the first medication they gave you that you kind of ran out quickly on before the Dilaudid?
It was Percocet.
Percocet. So let's ask your doctor, because I'm sure that to help you with the amputation, you may get a syndrome called phantom leg pain, like even though your leg isn't there, it's still hurting. So that's when your doctor should prescribe something like gabapentin that may assist the Percocet so that you wouldn't take it so often. You follow me?
Yes, sir.
Yeah, so I'd ask the doctor for a gabapentin, and that probably would help you much more than the Lortab or the Percocet would, because the issue that you're going through is a neurological issue. It's pain, but it's also, you know, it's neurological in nature.
Okay.
You follow me? So just tell them, hey, my pharmacist recommended that, you know, maybe I should be on gabapentin 2 for this phantom pain.
All right. Okay, thank you.
Yes, sir, you're welcome. And yeah, so people, yeah, narcotics is a very serious thing. You know, we rank up there probably tops in the country for diversion and abuse. So I'm telling you here right now, if you did not know, we can track everything. Big Brother is real. And so when you come to my pharmacy, you fill a prescription, you better believe we are going to check that database, okay? So, and I still get people who try me. Y'all, I'm not cool, okay? I follow the letter of the law. And if you are early, your doctor better give me a heck of a reason why you need it. Otherwise, it's gonna be no, especially if they say it must last 30 days. But I'm understanding, I know this stuff happens. Now, I'm amazed at how many times people's medicine gets stolen or lost to flush down the toilet, but I understand this stuff happens. You come in, you're honest and forthright, and you explain your situation, and I have a conversation with your doctor, then, you know, I may be a little yielding. But for those of you who are doctor shopping, better stop it, because we can see down to the day that you're, and just ask all the people that I've turned away, you know. So enough of that, but stop with the diversion. I think we had a few people call in a couple of shows ago getting me to describe pills that they were taking. That is diversion, taking pills from their intended use and making them for an unintended use. So if you are there and your friend gives you a pill and it's a narcotic, that is diversion. It is diverting it from the patient that it was intended for to you. And you have to be careful, because this stuff is very strong. A lot of the medications I see people on, they were originally intended for people in cancer pain on their last leg. You know, but some of these people are taking them just because you fell down the stairs. So you have to be careful with these things. They are very, very dangerous, you know, if you use them on the wrong person. Especially if you're a small frame person or a person who metabolizes this drug slowly, these things can shut off your breathing. Okay, so be careful with that. All right, so back to the healthcare legislation. So it looks like the new Trump plan wanted to deal with two key provisions of the Obamacare piece. So we had Obamacare, stop calling Obamacare. The Affordable Care Act sought to make insurance affordable, which is why it's called the Affordable Care Act. So if there are any of you who are Trump supporters and you're on the Affordable Care Act, guess what? You are on Obamacare. They are one and the same. It was given the Obamacare name, I guess, to demonize it and make you not want it. But I understand that many of you are on it. So the key provision was, hey, insurance is high. The president wanted to make it affordable so that you could afford it. Case in point with me, I talked to, I better not name them on the show here, but I talked to an insurance company about insurance. So they gave me a quote of $700. So I went on the marketplace, that same policy, the Platinum plan, zero deductible, $400 less under the Affordable Care Act. Same insurance. Okay, so President wanted to be affordable. The other piece that the former President Obama wanted is that we want to eliminate pre-existing conditions, because prior to that, insurances could deny you. If you have congestive heart failure or any type of disease or psychiatric illness, they could just deny you and you don't have insurance coverage. So the president said, you know what? That's not fair. American people are sick. Too many have died from lack of health care. we are mandating that you not only accept people who have pre-existing conditions, but you do not charge them even more because they have this pre-existing condition. So that's the Affordable Care Act. That is President Obama's piece. So from the Republican platform's stand, what they are wanting to do is to repeal that pre-existing condition clause. And what they're saying is, I believe it was, gee, I forgot his name. I'll have to look it up, but he was out of New Jersey. So he added in an amendment that basically gives states the right to opt out of that. So if you're a Tennessean and you have a pre-existing condition, congestive heart failure, you know what? State of Tennessee's plan can just say, you know what? We're going to opt out of it. So it's basically saying insurance companies must cover you unless they don't feel like it. But we're going to get into that a little later. We're up on a break. We'll be right back. Kangen alkaline